everybody. This is Dr. Warren Kalkstein. I'm a chiropractor here in Baltimore, Maryland, in our office in Towson with Christine here today. And so I just wanted to kind of share your story, Christine, as well as what you've been doing in the office recently. So hip replacements are very common things, and I'm sure this is very relatable to people watching that either have had it or have talked to their doctor about it. And hip arthritis is a really common condition that we see in the office, as well as what people deal with from a pain standpoint. So before we dive into the hip arthritis that we're treating here, let's talk a little bit about just your experience in the office, your experience with chiropractic, and kind of how you've maybe broken the norm of who comes to see a chiropractor, right?
I've had scoliosis all my life, and my spine is fused. I have idiopathic scoliosis, spinal fusion a gazillion years ago, and I never thought that I would benefit from a chiropractor until I learned how important it is to have the soft tissue manipulation and how that helps me with my spine health and just overall health. Because the muscles around the spine and everything else are trying to compensate for what the spine can't do. I don't have any flexibility in there at all. So those muscles get no work. And having adjustments on my neck and rib heads and just a little bit on the backside has just been incredibly beneficial. I've been coming to you for how many years now?
Quite a few,
A lot,
yeah. I know. I'm grateful to be. It's you can start to get to know your patients over the years, especially when they're dealing with some things that don't necessarily go away within a day, right? That stick with us a little bit more. So we're focusing on movement. We're focusing on things that tend to tighten up on you because of idiopathic. No reason, no pathology. Unknown pathology for scoliosis is the most common type of scoliosis. And the way she was treated and when she was younger, because of the degree of the scoliosis that she had, to save the vital organs, right, to help with some of that compression that was occurring. She had rods, and she's fused basically from her upper back down to her lower back, right? And so the joints that are adjustable or that I can work on are in the cervical spine as well as around the sacrum and the pelvis area, and then the big things that you mentioned were the rib heads and the soft tissue, the muscles around those areas. So I'm manipulating, I'm stretching, I'm pinning, stretching, and mobilizing those areas for her when she comes in. It gives her a lot of relief to the pain that she experiences in her back, as well as helps with her range of motion so that she can still function well around the spine, right? And so over the years, we've used drop techniques, which are gentle adjustments around those areas where she's fused, so there's not a lot of bending or twisting. And then in the neck, I can adjust her like you would see in a normal adjustment video, right? Now, due to the abnormal forces on your hips over the year, and there's a lot of reasons that we get arthritis in the hip, a lot of different things. So think micro traumas, so if you experience arthritis, stress to the tissue and repetitive stress can cause it. And then there's other things that play a role. Genetics definitely play a role, like most systems in the body. And then you also have even like things that treat the hip. So we often get in our society, we get injections like corticosteroids. It's something that is also that something could promote arthritis, which is kind of a double-edged sword with steroids. They help a ton, right, for people, but they can sometimes lead to earlier arthritis than necessary that's going to happen in a patient, right? So kind of coming full picture, hopefully you're going to get a general idea of how we've been working with Christine, whether it's dry needling here at the office, whether it's soft tissue work that I perform, whether it's seeing the massage therapist that we have in the office, right? So we have a nice balanced approach as it relates to manual work, therapy that we're using with our hands. And then in addition, we try to have the movement components of things. So for arthritis, and to the degree of arthritis that she has in her hip, I'm not really recommending too many floor-based activities. Simple things, yes, but water aerobics are really nice and helpful in cases like this to maintain strength, as well as really simple floor-based exercises, right? So we've used that in the past, but right now it's a different scenario, right? Right now we are trying to lengthen the timeline of this hip as much as we can and really fill the gap in between when you are getting a replacement for this hip, right? Yeah. So is there anything we can do? Yeah, 100%. Shockwave therapy is a modality we use to really hit a little bit deeper in terms of the soft tissue work that we provide, as well as create a change to the tissue, help break down some scar tissue, help relieve some of the stress on that joint, and really provides a window of relief that we can work in this case, to give her just purely pain relief, and because she is getting the surgery. She can't get corticosteroid injections before because they raise your risk of infection in a surgery like this. So she has to have a certain amount of time that she's getting away from steroids and drugs so that she can really get some relief in the form of a replacement. It's what she desperately needs in that area, right? So hopefully that gives you a little bit of perspective. And I think we talked a little bit about, because you've had the other hip worked on before, right? There's a replacement there.
So I've had, the right hip has been replaced already. The left one is due sometime early next year.
Mm-hmm.
All the things that all the modalities you talked about, I've done. And the massage is incredible. Dry needling helped me a lot. The heat and stim, and now the shockwave. I think I'm reacting well to all of them.
Good.
And they're helping. So they're helping me maintain or keep my pain levels, manageable until I can get this done. Because I do not want to have another steroid shot. The fewer pain meds I can be on, the better.
The better, 100%. So we'll speak to what we do well here, because I think that those people that take care of you outside of here do a great job. We're in Baltimore, and we have Hopkins, GBMC, Mercy, Sinai, great hospital systems and amazing support as it relates to that. So we're really appreciative of all the assets that we have just nearby. But from a conservative standpoint, what can you do? I mentioned aqua-based therapy. I mentioned exercises for the hip, keeping it moving, rolling out these tight and truly contracted muscles that she can get around the hip is huge. So doing the soft tissue work, natural stuff like glucosamine, boswellia, curcumin. Those are plant-based anti-inflammatories that we can show you. That there's a Thorne supplement called Bone Complex. I like that one. A total joint support. I think that's got all those things in it. So those are things you can take. That's habitual. That's going to be a very holistic approach to dealing with this, right? And then I'm going to show you, right, that now what we do relative to some soft tissue work. So, and I'll talk about what it looks like on exam if you're a student, if you're trying to be okay, how do I know if it's arthritis? How do I even know if it's even the hip that's causing pain? Because misdiagnoses happen all the time. Unfortunately, for your students, it's easy to pick up that it's hip, right? So I'm not going to do too much of that stuff. I'll just talk about it. The orthopedic techs are very sensitive in her case to picking it up, and she has a classic presentation. So we'll talk about all that stuff. But we're gonna do two things at once. We're gonna take care of you, okay? Because you're here for that is for sure. And I appreciate you sharing your story as it relates to coming in here. So I really appreciate her because she supports our local police officers and SWAT teams.
I do.
And takes care of them from a supply standpoint. She's been doing that for years, and she takes care of her boys and girls over there quite a bit with some pretty sweet gadgets and gear.
Love my law enforcement guys.
Yes, you do. There's a little backstory for you, if you will. There you go. Sit and relax. You will, for sure. So hip extension is tender for her. Hip flexion beyond 145 degrees is going to be a little sensitive. That's a quadrant sign test or impingement test that you'll hear in school. So if I bring her hip up kind of past this range, it starts to press on the joint itself. She's got a positive figure 4 sign, 4-finger sign for her hip. So 4-finger or C sign. So when she does this, my pain is here. Usually it's the hip joint. Okay, I know that might seem common sense to you. Pain can refer from the hip down in the leg into the buttocks area and to the side. More commonly in the front. They can distribute past the knee. Saphenous nerve can distribute hip pain down beyond the knee itself when it's really bad. Sharp, tingling, numbness you can experience in this area. There's other things that refer pain to the quad, so don't be try not to be diagnosing yourself too much with this. It's a full assessment and history is huge. X-ray is the best thing to demonstrate arthritis in the hip itself. MRI is going to show more labral pathology, tendinopathies to the hip itself. So all those things can be present in the case of an arthritic hip, but the joint itself doesn't like range. It doesn't like it to be moved too much. It doesn't like to be compressed, and usually you'll see upon walking some type of a limp on the side. She uses this in her right hand because it takes pressure off her hip. When she's on it, she's able to lean away from it and still balance herself. So this is a cane for her to walk. So you'll see that being used in cases like this when you come to the office. So watching people walk, watching how they sit, seeing what aggravates her for sitting for too long, and then walking, getting going hurts. And then once she's loosened up, it'll be good. And then after a while, it'll start to come back on her. Those are classic hip signs, if you will. Low back and disc related issues and facet related issues usually respond well to walking. So if I hear that someone's still having pain with walking, I'm thinking about the hip as well. Okay? All right, I'm talking a lot. Let me get to work. I'm sorry.
Is that right?
Some really gentle, passive pressures to the hip as I work in that area. So she just had shockwave for probably about 10 minutes on the hip itself. In the beginning, I was doing a lot of adductor work because she was so contracted in that tissue. It was really hard for her to even let go. I just her laying on the table like this for as much as I'm making her lay like this. Appreciate you. Is a good sign that she's kind of loosening up over the last few weeks. And I've been aggressively treating this for 3-4 weeks now. So we're in a kind of a sweeter spot than we were in about a month ago when she could barely move and walk. And I'm so happy that, at least for the holidays, we got a little relief.
I'm so happy.
So I'm going to take your knee up gently. I'll do the work for you. You'll notice when you have a patient that has this much discomfort that actively moving the hip itself in flexion is very, very uncomfortable. So I'm going to make sure that she doesn't help me out too much, even though it's kind of like almost an involuntary reaction when you're moving people. So I'm really supporting her leg. I'm really trying to hold on. And I'm going towards the psoas and the hip flexor muscles that attach towards the lumbar spine. Happy holidays to you, Christine. How are you? Remember to say this. We're all dressed up in holiday wear. I don't have a sweater that's holiday spirited right now with me.
Yeah.
So I was lame to the game. I did not come prepared this morning, but I grabbed my PJs that are kind of Christmas-like, and I'm making it work as best I can. But we have our holiday. Shout out to Breads and Circuses in Towson. It's a great local restaurant.
It's a nice restaurant.
Oh yeah, I've seen you
we
before.
always see each other there.
Yeah, that's right. We walk into Towson sometimes, which I love to do, and
We're having dinner out on the outside one
it was
night.
a beautiful
You and I
night, wasn't
walked
it?
up, Yeah.
I know we were like free there for a second, weren't we? We didn't have any kids in tow.
Yeah,
did
that's
we?
true.
It is. He does a good job. It's a little local spot here in Towson, and we celebrate our Christmas holiday every year there. So nice and easy. Go ahead and bring your hip up a little higher. I'm rolling down onto the hip, just nice and easy. This is actually if you want to get all technique specific, it's an SOT technique for psoas release. It's also a Webster technique. It's just passive pressure, manual pressure over the hip flexor, and I'm using like kind of the edge of my hand to just gently roll on top of it. And then I'm going to let her relax. I'm going to distract and then come up. Okay, so we're going to get a little work in here. You just kind of holler if it's too much pressure, okay? So I want to loosen up the psoas muscle, and just 60 to 90 seconds of compression over a trigger point like I've got right there, which you made that grimace, is a really nice way. And you'll find different angles that give great compression on trigger points. And so I will continue to kind of leverage my hand to find those places.
Grimace is my middle name right now.
I feel you.
It's better than it's been in weeks.
Yeah, it's so much better. I'm so happy for you. It gives me a freedom to manipulate her hip a little bit more too, which is intense but helpful. Before I'm doing mostly the passive modalities like this where I'm stretching. And I'll be able to drop her hip using the table, which is a gentle adjustment. And I might be able to get some long axis traction on it. But if it's tight and guarded and I do that, it just doesn't feel good and it's not ready for it. So as you're utilizing different therapies, again, like if I just let go of compression like that, sorry.
You won't do that again.
No more demonstrations.
No, let it go.
Sorry. Good. Go ahead and let it fall now. I got you right here. Drop, drop, drop. Now I'm stretching more the adductors and that line of tension in the hip flexor and pulling the knee across. And I got you. You can just drape your leg over my leg as best you can.
If I could.
I hear you. That'll work it. And then I'm gonna put your foot down, okay? So I'm gonna pull you down about
All right,
6
sure.
inches, okay? So I'm lining the back of the femur up with the drop piece. I'm checking the tension on the drop piece, which is the lumbar drop piece on this this zenith high-low. And my line of drive is gently through the femur. If I drop into her hip when she's guarding, it won't feel good. So I have to make sure that she's really relaxed. And I'll use my body to compress. I'll check with my opposite knee. Okay, it's a really good tension. I know how much force I need to use.
And I can relax into that.
You can relax all day into that. I've got your hip in its happy place, basically. So I want to affect those mechanoreceptors somehow. It's a really gentle way to do it. Okay? Loose. There you go. Good. Awesome. So I can take less pressure off my hand and more into my abdominal area, and now I'm dropping into it. And what I'll do eventually is I'll start to traction away and drop through. I'm really liking this. I can just feel it relaxing. Good. Okay. Quadrant test, impingement test, Trendelenburg's test to see how they balance and how they activate the glute med. Scour test to the hip, seeing how the range of motion feels underneath my hand, how smooth that capsule is. Those are all diagnostic. It's not going to treat her hip
The
right
fact
now.
that you can actually move it like that is huge.
What she's saying is I'm able to take her femur that's sitting like this right now. I'm able to do that to it. Before, if I did that, she would have
Huge.
grimaced. She would have definitely grimaced.
Or worse.
Or worse. So I encourage you, one, if you're a student, like really, I mean, you're going to see hip and low back together all the time. They are so closely interdependent. If you're not treating one and you're just kind of focusing on people's low backs, vice versa, you're just missing it. Don't miss it. Help people. So be good at examining, good manual palpation, PT, chiro, nurse, occupational therapist, massage therapist. Look at them both. Psoas crosses over, quad crosses over, into the pelvis, and the glute, everything. It's all just wrapped together. Alright, you're doing really good. I want to really drop here, okay? Good.
You did.
Yeah.
Careful the bite.
Oh, sorry.
It's on either side of the leg.
Is it?
Yeah.
Okay.
He nailed me on both sides.
You just had the poor pup. Yeah, you had a rough go. We
Yeah.
won't spotlight him too much right now.
That's not. Oh, that was a good one. Oh, those are really good. And that knee has a lot of arthritis in it too. That one had a bunionectomy.
Mm-hmm. Really common. Bunionectomy is when they shave down the edge of that first metatarsal.
You know, wrong shoes, working retail.
Yeah, he'll lock you up right there for sure. All right, I'm gonna put traction here. Is it okay?
Uh-huh.
Good. I'm gonna take traction here. You doing okay with that? Good.
So far, okay.
Okay. I'm just gonna roll you. Can you handle that?
So far.
Good. Take your left hip and gently hike it up towards your shoulder. There you go, just like that. Just get it activated, feel it contract. I let it drop. So I'm waiting for her quad to relax a little and her hamstring to kind of let go. All those muscles are still just guarding a little bit. Good. Now contract. Come on, hike it up a little bit. There you go. Don't worry about the knee going to the ceiling. We'll focus on your pelvis kind of rising up. There you go. Perfect. Now let it drop. I'll take your moment to breathe. So you felt the flexion drop. Now you'll see a little bit of movement in the long axis traction, and then I'll drop your pelvis from the opposite side. So I'm going to move the hip in 3 different, basically range of motion. I got you. So let it go.
Ah!
Good job.
Sorry, I didn't mean to make noise.
You're allowed to do it. That's okay. It's when people don't say anything, I'm like, are you okay about it? You gonna be alright? It's okay. You alright? Yeah. Good. So a little gap in the joint, a little release. Alright, table's gonna come up, okay? Take your time, stand up, I'll help you. We're gonna go on your stomach gently and we're gonna do some gentle pelvis rolls and maybe look at your upper neck in that position. We'll definitely adjust your neck in the chair too today, okay?
Super.
You're welcome, of course. So let's get this underneath your hips. It'll feel good to keep it in a little bit of flexion. It doesn't like to be dropped too low on extension like that. And I'll get your head and upper back comfortable once it gets down, okay? So in the compensatory pattern that she comes in with because of the pain, certain things are doing things that they don't really do, like all by themselves, if you will. There's a lot of guarding in her movement. So this area here is just really tight on her, right? It's hard for her to let go into this hip. But what I've noticed, like when she first came in, if you kind of look at this angle, she was really shifted like this. This is about a month ago. Now she's able to like actually feel her body touch the table over here, which is such a healthy sign. And she's gonna feel a little bit of movement through her femur, which is right here, and her pelvis. Just easy. Okay. Check. And I'll slowly add pressure. Slowly.
Can I come up
Yeah,
about
I'm
an
just
inch?
gonna ask
Yes,
about that.
it's right in my throat. Right in my throat.
How's
Perfect. Thank you.
Of course. Yeah, you can ask for anything. I got you. This video is second. You're number one right now, okay? I think it's really, I appreciate you taking time to share your story. And I hope that we continue to take such a proactive approach to dealing with physical and body health like you do. We need to do more of it, that is for sure. Low pressure, okay? There we go. Nice, settle, okay? So I have to be very, very delicate as I'm pressing through extension on the spine. I'm not trying to bend her spine at all. I'm trying to actually just move her ribs gently. This is just an easy way to do it. There's other ways I can create it, but I think this creates the least amount of pressure. Boom. So I'm just going to do some gentle work on your QL, okay, hon? Soft tissue work that we do in here is only done because we got this awesome balm from Huns Honey. Shout out to the lovely ladies down there that make this stuff.
That stuff is wonderful.
Yeah, it is wonderful. Great. It helps us kind of create a better touch, but also very soothing and relaxing. It's good for the skin. It's healing in its own right. And the program is very, very healing to Baltimore. That's down there. I love it, and I love the women that run it.
Where is that?
It's in a place called Curtis Bay.
Oh, okay.
Curtis Bay, just across just across South Baltimore near the harbor. And there's two components to it. There's the well, and then there's Hunt's Honey. The well is more of the nonprofit entity that exists down there, even though I think Hunt's Honey is a nonprofit too. But it's their commercial component of it. So it helps fund the actual well. The well takes in women that have been battered and abused, domestic violence, generational stuff that's going on in that area locally, and then gives them support, mental health, gives them vocational support, gives them community, gives them a place to really kind of rebuild their lives. And then Hunt's Honey is the actual thing that they start to, it supports the well itself. So they make a lot of honey-based products. They have honeybees down in the city, and so it gives them a job, gives them purpose. If they want that, if they work hard enough to create that in their lives. So the women that run Hunt's Honey are hard workers, and they're around hustling all around Baltimore at farmers markets, and they've got their products for sale on Whole Foods or in the link below. If this video gets you before Christmas or New Year's or afterwards because you forgot to get that present, it's a cool story that you can add on to it. Or if you're in the practice of doing soft tissue work, support them. They make a great product, and it's affordable.
Thank you. I didn't know about that.
For sure. No problem. So now I can actually
Ooh,
feel.
yeah, right there. Oh, golly. What is that?
That's the strong muscles you've got in your low back.
Oh,
So that's your
well, they're talking to me right now.
quadrilateral symphysis. I know. I'm talking right back. Trying to get it to do its job a little less aggressively. Let's just say that.
That's what gets seized up.
Oh, yeah.
Goodness. Wow. Wow.
Listen, all those Merry Christmases people are yelling at each other.
At the circle.
Oh yeah, the circle will get the best of people, that's for sure.
When the Soros's restaurant used to be right there on the circle.
Oh yeah.
People would sit outside and just watch the demolition derby.
Yeah.
It was entertainment.
Yeah. It is entertainment, isn't that right? That's good. All right. You okay?
Yep.
Perfect. Okay.
Lovely.
That's lovely. All right, I'm gonna bring you up nice and easy. I think a lot of relationships in Baltimore County started at sources, that's for sure. There's a lot of firsts. I met my significant other there.
Did you really?
Well, I didn't, but I hear that a lot.
Okay.
Back in my day, I
got it.
Yeah, back in my day, I didn't go to sources. I won't say the name of it because I was
Another place.
another place.
And Sources is not there anymore.
It's
So
not.
you can
It's
say
not.
no.
Yeah, and I was
Yeah.
but yeah, my brother Russ is now is he used to work there, so I knew a lot of the guys that would work there, and then I used to be neighbors with one of them that used to work there as well. So I had a lot of connections to sources, and the owner before they sold it, we knew them pretty well. You're doing pretty good. All right, so we're gonna focus on the left side of your neck first, okay? Yeah, right there. Okay. So to get to that, all right, do me a favor, take out those wonderful earrings so I don't bother your ears at all.
My festive earrings.
Very festive. Way more festive than my shirt, that's for sure.
Okay.
Good. You're gonna feel easy compression. Do your favor, just let your jaw relax. Good. And so the reason I do this adjustment with her is because I think I can isolate a lot better. Get a little bit more turn, let it go. There we go. Okay. And now you're gonna feel the left side move, okay? Turn to the right. There's that pressure right off the bat, okay? And turn a little bit more. Good. Breathe. Exhale, let it go. That's locked right there.
Wow. That one just went like way up there. Wow.
Good.
That was huge.
That was huge.
That was huge.
Okay, just manipulation on the occiput. That's why she feels a pull on the opposite side as well. And then I'm going to do a little stretching on her shoulders to loosen that muscle. It's a little tight on that right
was
side.
Huge. Yeah.
You'll be good to go. Okay.
That's wonderful.
Yeah, for sure.
Thank you.
You're so welcome. Happy to provide the support for you.
I'm all ready for the holidays.
Let's go. Any work party you're good for now, right?
Yeah, ours is next Tuesday.
Where are you guys going?
We have it in-house.
Nice.
At the old courthouse. It's kind of a potluck thing.
That's nice.
I make this lovely cranberry salad and oranges and pineapple and jello and apples and
God bless. That sounds amazing. Oh, you got my stomach singing right now. We have all the meals prepped up. We got crab cakes, there's gonna be steaks, there's gonna be all kinds of good stuff that Steve's gonna cook up for us. So we're really excited to celebrate. We mark this on the calendar as a special event every year. Turn your head to your left for me. Tap your chin. So, thank you for watching. I hope that you learned something, enjoyed, got some inspiration, or have a better understanding for whatever you're going through. And I'm so grateful to get to work with you and be here with you on your journey. And thank you for watching. Have a wonderful night. Huns Honey, get some for yourself. Get some for someone that you love. Do a little massage on their shoulders, even if you don't know what you're doing. It'll feel good. They'll love it. They'll appreciate you. Have a good night.
Thank you.
You're welcome.